Now, today's topic is addressing the two Medicare options that are available for veterans, provided those veterans are VA eligible. Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid making mistakes, and above all else, get the most out of your Medicare benefits. Let's talk about the details of these options. First off, you have to know that Veteran Administration benefits are not the same as TRICARE for Life or CHAMPS VA. When someone's eligible for VA benefits, this means that they served in the military, they served our country, and thank you for doing so. And what happens is the government will establish your eligibility depending upon where your service was and how long that you were in. So you qualify for VA benefits. People that have TRICARE for Life or CHAMPS VA as an insurance, these are people that served our country and were in long enough to be able to retire. So military retirees are all available to use these two types of insurance, TRICARE for Life and then sometimes spouses, CHAMPS VA. All right, so I'm not talking about either one of these today. I'm just only talking about VA benefits. Now, I meet people all the time who served our country and they're veterans, but they have never yet established exactly what their VA eligibility looks like. In other words, they haven't gone through the process to know how much the VA will pay and what will be their part in their healthcare cost with the VA. So I would encourage you, if you did serve but you don't know, then you need to find that out. Go through the process of finding out exactly what your VA eligibility is going to look like. And then the third question is this: are you pleased with the VA system? Meaning you have gone through the process, you know what you qualify for, and you've used VA hospital or VA doctors. And are you pleased with that system? And so depending upon the answer to that question will determine what you need to do with Medicare. So let's assume that we ask the question, are you pleased with VA? And you say yes to the question. If you do, then what I would encourage you to do as you're approaching Medicare eligibility at 65 or beyond at retirement, I would encourage you to go ahead and enroll in Medicare A and B. And then what you could do, if we like the VA system, is instead of getting like a supplemental plan to go along with A and B, you can get an advantage plan to actually replace A and B. This is a private health insurance company that replaces Medicare A and B. Now you're still enrolled in A and B, but now you get to use the private health insurance company options. And so many veterans find this to be advantageous, and here's why. Because what you have with the Advantage plan, and most of them are zero premium, what you can do is you can use the VA when you want to, and then you can use your civilian network doctors by the Advantage plan whenever you want to. So you have really the best of both worlds. You may have a sinus infection, and instead of having to go to the VA to see them, you may just call a local doctor that's in the network and get treated there. So there could be a time when you want a second opinion. And so you can, again, use your Advantage plan to get that second opinion. And so you can use both, either or, whatever is the best in that particular situation. Now, another nice thing about Advantage plans is they throw some additional perks in that the VA is not going to cover. Number one, dental. So this means that the Advantage plans include some type of a dental coverage within their plan, usually somewhere between about $1,000 or $2,000 a year in dental benefit. They also offer some vision benefits, some credit towards eyewear, and a preventive eye exam on an annual basis. And then also hearing aids. And so if hearing aids is a need of yours, the Advantage plans usually have some pretty good options. You would pay a very reasonable, a relatively small copay, and then they would pay the rest for that hearing aid. So you can do that on the Advantage plan. They also include some type of a gym membership. This means that if you're going to a gym that will accept that Advantage plan, then you can go there at the gym and there's no cost to you to be able to work out there. So a lot of the Planet Fitness and community centers and YMCAs, a lot of those places will actually allow you to work out there for free. And then lastly, then you also have what is called an over-the-counter card. And this is something that is a benefit attached to Advantage plan. And it basically works like this. They'll give you about $50 to $75 every quarter, and you're able to go online or use a catalog, and you can actually order over-the-counter items through that system, and they will send it to you by mail. And so that's a very nice benefit as well. So if you like the VA coverage, then that Advantage plan could be very good. Now, you'll also be able to get what's called a Part B premium reduction. Now, this video is being shot in 2022. The Part B premium, what you pay Medicare, is $170.10 a month for most people. That $170.10 a month comes out of your Social Security check, or they actually will bill you for that on a quarterly basis. And so if you're a veteran, you can qualify sometimes to have that Part B reduced, could reduce maybe by $50 a month or $100 a month, sometimes even totally eliminated. And the way that happens, the total elimination or a great reduction in Part B is when you enroll in what's called a Medicare Advantage only plan. In other words, that Advantage plan covers inpatient and outpatient, and you get your prescription drug coverage not through the Advantage plan, but rather through the VA. And so if you like the copays on your prescriptions at the VA, then you use that system for your prescriptions, and then you just have a Medicare Advantage plan only for inpatient and outpatient when they put that network of doctors together. So that's a very good option. When people do that, then they get really a very nice reduction in their premium. All right, so that's going with the Advantage plan. If indeed you're happy with VA, we have really the best of both worlds. You can choose one or the other. Now let's suppose you're not happy with the VA. You know your eligibility, you've been to the hospital, the doctors, the VA, and you're really not satisfied with that system. Well, then we treat you as though that's not even an option any longer. And so then what most people do is either they'll get an Advantage plan or they will get a supplemental plan. So you have to, of course, enroll into A and B, where Medicare is the primary payer, and get a supplemental plan to fill in the gaps when Medicare did not cover. Medicare covers well, but there's still some serious financial liabilities that remain yours, and so you may want to transfer that liability to an insurance company, and they will issue a supplemental plan. Most people today are getting either a Plan G or a Plan N. Both of those are very, very good plans, and if you decide to go this direction, you can get into the details of those plans. Now, lastly, I want you to know, as far as a prescription drug plan, if you're getting your prescriptions filled at the VA and you're happy with that system, then you can continue to do so. In other words, you would just use a Medicare Advantage only plan for inpatient and outpatient whenever you chose to do that, but you still get your scripts through the VA. But if you don't want to get your prescriptions through the VA, then we actually can add a Part D plan to your coverage. And in most zip codes, there's 15 to 25 different choices to choose from. So we find the plan that's best for you based upon the medications that you take in the pharmacy that you want to go to. All right, so that's what that coverage would look like if indeed you're not pleased with the VA. So you do have some options, and depending upon your view of the VA and how that's gone so far is going to determine exactly which one of these is going to be best for you.
Hey, thanks so much for watching the video, and I do hope that it was helpful. Now, if you feel like you need to learn more about Medicare to make sure you're making the right Medicare decision, really the best way and the easiest way to do that is to go to MedicareSchool.com. That's MedicareSchool.com, and you'll be given the opportunity to click on Get the Free Workshop. We call that the Essentials Workshop, and I do all the teaching, and there you'll learn all the ins and outs of Medicare to make sure that you have an accurate and thorough understanding of how Medicare works. The second thing you can do is click where it says Talk to a Medicare Guide, and there you can actually set up a time where you can discuss your situation with the Medicare Guide. They'll explain all your options, and they'll actually even walk you through the enrollment process as well if that's what you need to do. And so go to MedicareSchool.com, watch the workshop, or talk to a Medicare Guide. It would be our privilege to assist you further.